tend to delay treatment and fats tend to save lives. That is the norm for all malignancies in the human body. There are a lot of myths associated with cancer per se, but for cervical cancer, and I would say particularly for screening, there are a lot of myths going on in the community. Firstly, since people are not aware of the timing of the screening test, most people feel that screening is only for promiscuous populations. But that is not true. Even if you are monogamous, still you would require the screening because the human papillomavirus infection can happen even in a monogamous sexual relationship. So it is important that any woman who is sexually active should go for her first pap smear examination after 3 years of commencement of sexual activity. Another myth is that if you've had one test, you need not get tested again and again. That is not true. If your test is normal, that is, it is negative, that indicates that now you need to go for test every 3 yearly till the age of 65 years. However, if there is another test which has been accompanied with this pap smear, that is the human papilloma virus DNA test. If that also has been conducted and is negative, then you can increase the frequency to once in every 5 years till 65 years of age. One more myth which is quite prevalent is that if you are vaccinated for cervical cancer, that is, you have undergone a human papilloma virus vaccination, then you don't need a pap smear. That again is not true because the vaccine is available only for a limited strains of viruses. There are many more viruses which do not come under the purview of the vaccination. So despite vaccination, pap smear testing for screening should be conducted as per the schedule. Then most people hesitate in pap smear because they feel that it might be a very painful or a very discomfortable test. I would reassure you that it is just a 3-4 second of discomfort and it is not painful, and it is rather very reassuring that once you get yourself tested and it comes negative, that you are not harboring any pre-malignant or malignant condition. These tests are conducted in a very private clinic environment. There are women who are conducting these tests, and you should not hesitate to go for these tests because it is this mindset of hesitation and shyness which forbids women to come forward for these tests. Many a times people don't come for screening tests when we hold camps, considering that kuch nikal aaya to. So don't go with such mindsets for examination. The screening test purpose is to find out hidden diseases, because if they were not hidden, then you would have known about them, you would have sought medical attention. So do not linger the screening test, because that is the biggest tool in your hand to protect yourself from this deadly disease if not treated in time.